So I've picked up 10 questions from the gram that you guys have asked me, and let's dive into it. The first question here is that this person here has started using retinol, hoping that it'll work on their acne, but it hasn't helped. No surprises there. So to break it down, retinoids are a huge family of molecules, right? Retinol being one of the milder ones, and adapalene, tretinoin, trifarotene being the superior, stronger guys in that clan. Now, retinol is really mild, it really helps to fight signs of aging. You can keep using it long term, started in your late 20s. It'll really help to reduce oil production to some extent and basically build up collagen, increase your cell turnover, and all of that. But it's mainly for anti aging. If you have hardcore acne, and you've seen videos where people talk about using retinoids on your skin for acne, to remember they're not talking about retinol, they're talking about adapalene and tretinoin and trifarotene, which are the big guys. These guys need a prescription from your dermatologist. Please do not start this off on your own. You need a prescription. They're strong, they can cause a lot of scaling, they can initially cause purging. You need to moisturize, protect your barrier when you're on them. So talk to your dermatologist and then definitely start retinoids. It really, really helps with your acne, but not retinol. Question number two: what kind of foods trigger acne? Now, when we talk about acne related foods, it's typically dairy and it's sugar. Okay, dairy and sugar have been the only ones that have had a proven association with acne. A lot of people think it's just fried food and fatty food. Yes, that's bad for you. Not saying that's good for you, but there's no proven research backed association. So when I talk about sugar, I'm talking about anything that will get your blood sugar level up. So it's not just refined sugar, it's also honey and jaggery, anything sweet, high carbs, high glycemic index, all of that is going to get your blood sugar levels to go up. So that's going to worsen your acne. Now, milk contains something called IGF-1, which is insulin like growth factor 1, which is this bad guy responsible for breaking you out after you have a lot of dairy in your diet. All of it, okay? So chocolates, milkshakes, milk, cheese, paneer, ghee, all of it, try to cut down on. That is going to flare your acne. I'm sorry, all the good things in life are going to flare your acne. Sorry to break it to you. Relatively fermented milk products like curd and chas and lassi, they're supposed to be less acne causing. But in saying that, by the same logic, whey protein shouldn't then cause as much of an acne breakout, but it does. I have seen this in so many of my patients. A lot of people start breaking out with whey protein, even with whey isolate, which technically shouldn't be causing as much of an IGF-1 spike, but it does. So try to avoid both whey protein and whey isolate. If you're working out, switch to other protein sources. It's not about a veg versus non-veg debate here. But plant-based protein sources would be a better choice, or any other meat-based protein sources also work. Just dairy is known to break you out. What should you eat? Look for stuff like fiber. So a lot of fruits and vegetables. Don't overdo the fruits because you are going to get a lot of sugar load coming in from there as well. But look at a lot of fiber, a lot of antioxidants in your diet. So different colored fruits and vegetables, a lot of dry fruits and nuts. Seeds are also excellent. If you eat non-veg, fish is excellent because of the omega-3 fatty acid content in it. All of these are great sources. Drink a lot of water, and I think that's what will help your acne. The next question is somebody who's using vitamin C but is not helping their acne marks to fade. Because when you use vitamin C and you're acne prone, you may tend to break out even more. I know it doesn't happen to everyone and it shouldn't, again, in theory, but I have seen far too many cases of acne breakouts post vitamin C. So please be a little careful on that front. Azelaic acid would be a much better choice. Niacinamide, a much better choice for post acne pigmentation. Even your retinoids, your kojic acid, licorice, all of these, even glycolic acid is a great choice, but just stay away from vitamin C when you're acne prone. The next question is, how do I know if my acne is hormonal? A lot of clues that can help you find that direction. One is your distribution of acne. Not always, but more often than not, if it's a hormonal acne, it's going to be along your jawline. So typically on your chin, on your upper neck, or just along your jawline, your lower face, very often that would indicate a hormonal acne. Also, if you're a female, look at your menstrual cycles, right? So if your cycles are coming super late or they've just gotten more irregular than they used to be, a 40-day cycle could be a very big giveaway of a hormonal cause of your acne. something like a PCOS. Look for excess facial hair, look for hair growth on your chest or your abdomen. These are also important giveaway signs that could indicate that it could be hormonal. A lot of people come and ask me that, I get a premenstrual flare. So just before my periods, I tend to break out. So does this mean that my acne is hormonal? Not necessarily. This typically happens to everyone. Premenstrually, one or two tiny breakouts here and there happen to literally everybody. So do not worry about that. That would not indicate a PCOS. Now, if you do suspect a hormonal cause, like there's weight gain, there's hormonal looking acne, there is increase in facial hair, there's a thinning on your scalp, there's an increase in body hair, like on your chest or your abdomen, all of these could be indicators. If you suspect it, yes, you can get tested for PCOS, talk to your dermat or talk to your gynac and you can test for PCOS. But if not, there's no need to over investigate and just test for the sake of it. Even if it is a full blown PCOS or even if it is a full blown hormonal cause of your acne, initially the only treatment people are going to give you is lifestyle modification. So start exercising every day, watch what you eat, the food triggers that I mentioned earlier. Try to work on those, avoid those, live a better lifestyle. Very often, just through lifestyle modifications, your acne may just get better. So don't stress too much about it. The next question is, I have a lot of pits on my face after my acne faded away, and please suggest a cream for the pits. Again, a very common question. Unfortunately, I hate to break it to you, but most creams do not work on these acne scars. It's unfortunate. If at all anything works, with significant data and evidence backing it, it's retinoids. So retinoids, as I mentioned before, not retinol, adapalene, tretinoin, trifluridine, those are the ones that can make any difference to your skin texture by boosting that collagen production. But more often than not, we need to go in for procedures to address your acne scars. Those pits are what we call depressed acne scars. So there can be pinpoint ice pick scars, there can be boxcar scars, or there can be rolling scars. All of them are treated slightly differently. There's a lot of procedures available. There's subcision, there's TCA cross, there's a punch excision, there's MNRF, which is my personal favorite. There's a CO2 laser, erbium YAG laser. There are so many things that can be done for acne scars. We can even subsize and do fillers, autologous fat, so many things. But it is usually procedural. Do talk to your dermatologist if it's very prominent. And unfortunately, a cream is not going to make the cut. Next question is body acne. What can I do for body acne? Now, a good question, because most of the time we're always talking about acne on your face. On your body, you can use even stronger percentages of creams and it won't irritate your skin as much. So typically it happens on the back. I see a lot of patients post waxing their back that break out in body acne. That is one cause. Second cause is dandruff. Dandruff on your scalp falls off on your back, triggers acne. Sometimes it's just a tendency for body acne and there's no major cause that you can find on why it's happening. Now, if you do have it, two kinds of cleansers really work well. One is a salicylic acid based soap or a body wash, which you need to keep in contact with your skin for about 5 minutes, or a benzyl peroxide based cleanser. Again, keep in contact for about 5 minutes and then wash it off. Massively helps new breakouts and with the reduction of body acne. Second thing that you can use is sprays containing things like clindamycin or salicylic acid or azelaic acid work beautifully. Retinoids you use for your face can be applied on your back as well. Mixed with a moisturizer, of course, really works well to reduce that body acne. Next question is, should I start Accutane? Okay, you might have read online that Accutane works beautifully. You have a grade 4 acne, so yes, your dermat also may give you Accutane. But Accutane is a very strong medication. Please don't start this on your own. You need a prescription. Before starting Accutane, which is basically isotretinoin, we do a bunch of blood tests. We check your liver function, your cholesterol levels. This is a strong medication. Don't mess around with it based on something you saw on Instagram. You need a dermat's prescription. It works extremely well, but it can cause a lot of dryness. It can cause a little bit of constipation sometimes. It is absolutely contraindicated in pregnancy, like to the point that you may have to terminate your pregnancy if you were on Accutane when you conceived. So don't mess around with this, guy. Do not start this on your own. Next question, is it contagious? My girlfriend has it and I'm worried I may get it from her. No, that's not true. Don't be a dick. Okay, sorry, pardon my language. But it's not contagious. You're not going to get it from her. Do not worry. But if it's really bad, I think you should be there for her, support her, help her find the right kind of treatments to work on it. Don't worry, you're not going to catch it from her. God. Next question: is there a permanent cure? I've been on treatments, but is it going to ever stop? Now this is a good one. It's a tough question to answer. Frankly, very often we see acne happening in your teenage years around puberty, and then post your 20s it starts to settle. Sometimes we see adult acne where you were fine through your teenage and it starts post your 20s or post your 30s, sometimes even post your 40s for the first time. Now, no one can tell you at what time your tendency to break out will go away. Nobody can tell you that. But as long as you have that tendency, you can do maintenance skincare to just prevent those breakouts. Okay. A lot of patients come to a dermatologist, they'll see us, they'll take treatment for a month or two, and then they just vamoose. They just don't come for their follow ups. That acne is gone. And then 3 months later, they're back saying that, Arey, jab tak I was taking your treatment, it was fine. And as soon as I stop your treatment, it's all back. But that is going to happen because that's a natural tendency that your skin has at this point in your life for whatever reason. Now, if you are prone, you're going to break out. So you at least need some level of maintenance skincare, a very minimal level of maintenance skincare to prevent those breakouts. Once, maybe a couple of years later, your natural tendency to break out goes down, you can stop using those active ingredients and just go back to a very, very basic skincare routine. But yeah, unfortunately, you can control it, but nobody can tell you if it's going to go away forever or not. Last question is that I see a lot of my friends who also have acne, but they never end up with scars on their face, but I always do. What am I doing wrong? Now, this is again a very great question. A lot of components go into that tendency to scar, the biggest being genetics. So, there was a really nice study in which they studied the genetic basis of your tendency to scar, and it's huge. Literally, there are some people who will have grade 4 very, very nodulocystic acne and they never end up with a scar. And there may be somebody with just one or two breakouts who will end up with scars. So there is a genetic tendency for that acne scarring, which we need to acknowledge. See, why scarring happens is you have a pimple when it bursts or breaks open within your skin. There's a lot of inflammation in that area, and collagen gets deposited in a haphazard manner just to facilitate that healing. This mass of collagen then contracts and it causes the skin to get pulled down and you end up with an acne scar. Now, the more the inflammation, the more the scarring. So, if you pop your pimple and you're forcibly making it burst, the inflammation there is going to be huge. So, your tendency to scar is going to be way, way more. So, you need to stop popping your pimples to make sure that you don't scar. Next, of course, is sun exposure. If there's more sun exposure, there's more inflammation, so more tendency to scar. So make sure you're sun protecting when you have active acne itself so that it doesn't end up leaving scars on your face. The last thing I want to talk about is a lot of parents typically stop their kids from treating their acne when it's in the early stages, saying that, this is your teenage years, it's bound to happen, don't fret about your skin so much and don't do all of this skincare drama and all of that. And they stop you from taking treatment. Now, the problem is that yes, your acne may go away. It's true. What they say is absolutely true. In your teenage years, you have a tendency, by the time you're in your 20s, it may go away on its own. But what about the scars? If you scar, no creams are going to work for you, darling. So you need to then go in for your MNRF or your lasers, which becomes an expensive affair. And frankly, even with that, you get about an 80 to 90% improvement in your acne, but you will always have a little bit of a textural issue if you have scarred. So I really feel don't delay treatment when it's easy, when it's cheap in the initial stages. Control your acne before it goes to the stage of scarring. I hope this video has helped. I hope I've answered a lot of your commonly asked questions. If you have any more, please feel free to ask me in the comments and I will be happy to answer.